So we all know that dementia is an area of immense unmet needs. Can you please describe what the exact value offerings of your product is and how your technologies are unique?
Absolutely. So for people living with dementia, the most difficult and debilitating symptom is the decline in cognitive function. So that means that they lose their ability to remember things, learn new things, pay attention to things, and just do everyday tasks. So the unique value offering of what we're offering is that this therapy improves cognition in people with mild to moderate dementia. This is based on cognitive stimulation therapy, which is the leading non-pharmacological therapy with absolutely the most clinical evidence in the world, and we are the pioneers in delivering this to the patients.
So, what are your main target groups for your product? How are the patients currently being treated? And what stage of the disease progression does Brain Plus and its product come into play?
So we are in the mild to moderate phase, which is the two first phases out of the three severity phases of dementia. The way people are being treated today is that some of them get some Alzheimer's drugs that, in all honesty, doesn't help them very much and have a lot of side effects. The vast majority is not being offered anything and feel quite helpless, actually. So that is where our products can come in and really help by making cognitive stimulation therapy accessible to people with dementia. The first product is helping therapists who are doing this therapy today to deliver it in high quality and to save a lot of time, which is very important for the effect. The second product allows people with dementia and their family to do this therapy in their own homes. So that really makes it much more accessible to a lot more people.
And looking at specific milestones for your company, what do you wish to achieve both in the near term and also in the long term?
So in the near term, we are in early commercialization. So we want to reach proof of market in Denmark first. So that is something that we're aiming for this year. Then we want to launch into the UK next year, which is currently the largest market for this therapy. And we want to integrate into the educations of new therapists, which is something we're already doing in Denmark and Germany, and will begin doing in UK as well. And we will have clinical trial data coming out on the first product. We already have positive trial data from all our technologies that are going into the products, but on the specific product, we are getting clinical data in the next 3 to 6 months.
And finally, there's an ongoing TO2 warrant exercise, and it ends next week. How will you use the proceeds, and what do your future funding plans look like?
We will use the proceeds to achieve some of the things that I just described, in particular, like continue the commercialization and scaling process, running the clinical trials on the products in some of the target markets that we are going into. We'll need to do some work before we're ready to enter the UK, so it will be used for that as well. So that is basically what we'll use it for. We are also, besides being in the public markets, we have a TO3 warrant in March. So that was part of the unit rights offering this year. And then we are also have applied for some major grants. We've applied for up to 67 million DKK worth of grants. That's an ongoing process, of course, and we have progressed well with that.
Perfect. Thank you very much.